any of the above. If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they have been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Kenyatta University Teaching Referral and Research Hospital is a modern tertiary health facility with state-of-the-art services that ensure delivery of cutting-edge healthcare and medical research in Kenya and the region. Located on a 100-acre piece of land in Nairobi County, Kenya, the Kenyatta University Teaching Referral and Research Hospital is a Level 6 hospital with a bed capacity of 650. It is easily accessible by public means, private vehicles, and has a helipad to enhance accessibility, especially in an emergency.
KUTRH is a highly specialized Level 6 referral hospital, and our flagship project is oncology, cancer care. But we also offer other highly specialized services, including cardiology, renal, and we also have specialized services in clinical care, ranging from orthopedics to surgery to all the other services within the clinical care.
Kenyatta University Teaching Referral and Research Hospital is a world-class healthcare facility, a concept largely attributed to Professor Olive Mugenda and financed through a government-to-government loan from China. The hospital was officially opened in September 2020 and has continued to make tremendous contribution in support of provision of specialized health services.
We are now almost 4 years old since we started, and we have about inpatient population of about 360 patients and many more patients who come every day as outpatient. We are a purely referral hospital, which means we don't accept walk-in patients. They must be referred by doctors from other hospitals, with an exception of accident and emergency where those patients, we are able to see them, of course, as they come.
Living up to its founder's vision, the facility has reduced the need for Kenyans to travel abroad for medical care, while also increasing medical tourism from other African countries in the region. It is overseen by a dedicated and experienced team of doctors who are supported by a professional cadre of nursing and paramedic staff. Kenyatta University Teaching, Referral and Research Hospital is equipped with modern and sophisticated clinical and surgical equipment that provide comprehensive care for all aspects of health, from prevention to diagnosis, treatment and rehabilitation.
For us as a hospital, our vision is to stop medical tourism, especially the outward medical tourism, and we are deliberately looking at issues that take people away to other countries. We have dealt with the PET scan, and I can confidently say that the number of people who are going outside the country to get the PET scan treatment have reduced drastically. Now we have gotten CyberKnife, and as we get support from the government, we'll continue looking at the areas that make people go away.
Key services include accident and emergency services, diagnostic imaging services, surgery, pathology and lab medicine, physiotherapy and rehabilitative services, maternity services, specialized clinics, cath lab, oncology center including chemotherapy, radiotherapy and brachytherapy, renal unit, critical care services, wellness services, integrated molecular imaging services including PET, CT and SPECT, CT services and CyberKnife.
What we've done as government is that we have cascaded the issue of early testing to the county level. And that earlier testing from the county level will involve centers that we've developed. At the moment, we've developed around 4 cancer centers, regional centers, where we expect that patients would be able to be referred through the actual referral mechanism that we've come up with in the new thinking. And therefore, then they can be able to be diagnosed and be made, treated at that level. So this CyberKnife that is going to be launched on Monday by His Excellency the President is speaking to the thinking that we need and we have as government developed specialized treatment for non-communicable diseases.
Kenyatta University Teaching, Referral and Research Hospital has a hospitality center providing quality accommodation spaces for patients and caregivers, especially those traveling from far distances within the country as well as those seeking services from other countries. The hospitality center also features a restaurant and a fully equipped gym. The hospital's flagship project is oncology. Because of the specialized nature of the treatment, the facility is purely of a referral nature, with patients being referred from other hospitals.
Cancer National Institute, that is the one that is helping us to put all stakeholders in place. Number one, to create awareness in terms of what cancer is and what Kenyans need to do to be able to manage cancer. National Cancer Institute, together with our program heads here, then they have gone ahead to derive and prepare policies, guidelines and directives on how then we go about diagnostic. So for us to be able to know who has cancer and at what level of cancer. The same institute, together with our program here, then they have developed mechanisms in terms of how do we treat. So we have chemotherapy, we have radiotherapy, surgery, and now this, the very high level that we are going to, that is being installed at, commissioned at the Kenyatta University Teaching and Referral Hospital. But also important for Kenyans to know that those who are registered on NHIF, they can access cancer treatment, including this CyberKnife that is being commissioned by Kenyatta University Teaching and Referral Hospital.
One of the cancer treatment services now available at Kenyatta University Teaching, Referral and Research Hospital is CyberKnife treatment. This is a painless and non-invasive treatment for cancerous and non-cancerous tumors. The CyberKnife delivers precise pulses of high-dose radiation that target certain tumors and other abnormal tissues while limiting exposure to surrounding healthy tissues.
Contrary to what the name suggests, CyberKnife is actually not a knife, but rather an advanced radiotherapy machine that delivers very high doses of radiation with sub-millimeter accuracy.
With the cyber knife, doctors are able to reach areas of the body that were previously thought untreatable, such as head and neck cancers and brain tumors, with a sub-millimeter accuracy. The precision of the treatment limits damage to healthy tissues, reducing side effects. Another benefit of this treatment method is the almost immediate recovery. These benefits make CyberKnife treatment ideal for patients who are unable to or prefer not to undergo conventional surgery.
We needed to get an equipment which can provide precision treatment, and that is why we started thinking, okay, we now can diagnose cancer at very early stages, but what do we do about those patients who need treatment? And we needed now to think of then, completing that continuum from diagnostics to treatment. And then we started looking for one machine which can, complement what we have, but very specialized so that people don't have to go outside the country to seek this particular service. Some of the conditions that can be treated using CyberKnife mainly is both cancerous tumors and non-cancerous tumors. This machine is the second one in Africa after Egypt.
First, allow me to congratulate the leadership, starting with the chair of the board, Professor Olive Mugenda, together with the CEO, Dr. Dagane, for this milestone that they're achieving in terms of being able to commission CyberKnife. As you are well aware that on the continuum of care of cancer, WHO has played CyberKnife as the best, actually the topmost, in terms of precision, in terms of dealing with the surgeries, dealing with cancer cases.
Kenyatta University Teaching Referral and Research Hospital is led by a board of directors as well as a management team responsible for the management and administration. The hospital's directorates are clinical services, nursing services, administration and corporate services, planning, development and partnerships, training, human resource development, integrated molecular imaging center, and research and innovations.
It's really good for us to have this sort of specialized machine here because it's, first of all, it's non-invasive. It means that it is very safe and effective for treating cancers. And of course, we are excited for us to have this kind of treatment here because Kenyans, it means Kenyans now will no longer be going to India or other countries seeking those services.
Our vision remains to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens, with the mission to enhance quality of lives through provision of quality patient-centered and evidence-based healthcare training innovation and state-of-the-art technology. Kenyatta University Teaching Referral and Research Hospital services are carefully priced to ensure that they are affordable to Kenyans, while at the same time ensuring sustainable operationalization of the facility.
stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. ICE. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ICE. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance.
People may faint as a reaction to pain, exhaustion, hunger or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/donate. When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby. In young children,
Thanks for
seizure,
watching.
also known as a convulsion or fit, can be caused by raised body temperature linked to throat, ear or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position, call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped, Open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
The new Kenyatta University Teaching, Referral and Research Hospital is the boldest, most sophisticated health facility initiative ever undertaken in Kiambu County and Kenya. A project that has created a global health center that ensures Kenya and the region has world-class facilities that cut across the entire health arena to serve generations and contribute significantly to the Kenya Big Four agenda, specifically universal healthcare for all and the global sustainable development goals.
The President has made a commitment that this becomes a center for excellence, particularly for oncology in this country.
Kenyatta University Teaching, Referral and Research Hospital is a 650-bed capacity hospital with state-of-the-art medical equipment.
Kenyatta University Teaching, Referral and Research Hospital is a level 6 hospital. We will be offering specialized care. We will be expecting patients to be referred to us from other levels of care. So we'll expect patients from level 5 hospitals to be referred to us, those who require specialized attention.
The hospital is located on a 100-acre piece of land that lies in the northwestern part of Kenyatta University, bordering Kahawa Barracks to the south and the Northern Bypass Road to the east. The main entrance to the hospital is on the Northern Bypass Road near Kahawa West. It is easily accessible from main roads and public transport services. The hospital also has a helipad, a landing strip to enhance access. Following the preparatory phase of design and preparation jointly carried out by China Jiangxi Corporation and Kenyatta University, groundbreaking was undertaken in 2011 with the objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the then Minister for Finance, who is now the current President, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm happy that the vision we had 10 years ago has now been accomplished, and now we have patients accessing our services in this hospital.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and at the same time attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation.
Even though we have many specialized areas in this hospital, our flagship project is a cancer, or what we are calling oncology center. And this center has 74 beds, and already we have started admitting patients. But I must also add that it's going to be a purely referral hospital. So our patients are being referred from other hospitals because of the specialized nature of the treatment.
Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital.
I would like to thank the board members who are behind here, who have been working very hard, hiring the right staff here. As the CS said, we have the doctors, we have the nurses,
We have other staff members who will be working with us.
The major directorates of the hospital are clinical services, nursing services, corporate services and administration, finance strategy and planning, training, research and innovations. The highly sophisticated medical center shall offer quality medical care with the following units: ICU, HDU. KUTRRH has the highest ICU and HDU bed capacity among the healthcare establishments in Kenya. There are 24 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs. They should expect quality health care, and we are ready to provide that care. We have qualified nurses and doctors on board, and all the nurses here are critical care nurses.
The burden of cancer is rising within our nation, and therefore KU is well placed in handling all matters regarding cancer. We'll be dealing with initially diagnosis and treatment of cancer. Treatment will involve having a radiotherapy machine, which is the most modern, called the linear accelerator, and we'll also be giving chemotherapy for patients who have cancer.
Every unit is equipped to treat every type of procedure, including trauma surgeries. Medicare is further supported by the availability of telemedicine to enable doctors to consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. The ultra-modern laboratories are